Welcome to San Antonio, and thanks. It's great to see everybody here. And thank you, my friend, Dr. Kalin. What a pleasant and nice introduction. We have an amazing assembly planned for you over the next few days. And I want to make sure you don't forget the President's reception on Friday night. I will see you there, and I will have my boots on, but no spurs. Please join me in welcoming the past presidents of the Academy. Please stand or wave till we acknowledge you. I especially want to thank my mentors who are in that group. Dr. Barbara DeLatour, who is here today, who was president in 1988 to 1989, and Dr. George Kraft in 1984 to 1985. I want to acknowledge another past president that was instrumental in my early career development, Dr. Justice Lehman, who was president of the Academy in 1972 to 1973. Dr. Lehman was the founding chair of the department at the University of Washington. He had a vision and passion for excellent patient care, research to prove what we do is effective, and teaching the next generation. I also want to thank the immediate past presidents who I've worked with and learned so much from during my years as a member of the Academy Board of Governors. Somehow, it is fitting to me that we are in San Antonio for our annual assembly this year. My very first annual assembly was 30 years ago in San Antonio. I was a fourth-year resident. As you can see from the photo there, this is in the newsletter, the photo in the newsletter, this was the year Dr. DeLatour was Academy president. And that's me 30 years ago. So even then, the gray hair was catching up to me. You could see how I got it. At that meeting, I remember hanging out with my fellow residents on the Riverwalk, touring the Alamo and feeling awkward wandering around the job fair where I saw some of you last night. Let me tell you, it's a lot more fun to be on the other side of the job fair table. For those of you that are completing your residencies or fellowships this year, welcome to the best medical specialty, physical medicine and rehabilitation. I recommend that you become involved with the Academy as I have. You will find a wonderful organization that is constantly working to advance the specialty and promote high-quality patient care provided by physiatrists. And who knows, in 30 years or so, you may be standing up on this stage. As we navigate the changes occurring in healthcare, your Academy acknowledges the need to develop and train future generations of leaders. The Academy Future Leaders Program, established by the Board of Governors in 2012, strives to do just that. Today, we'd like to celebrate this year's graduating class, as well as our incoming class of leadership fellows. Will members of the 2017, the 2019 class, and the 2019 to 2021 class please stand or wave so that we may express our gratitude for your contributions to the specialty. I'm going to spend the next few minutes telling you some history of our specialty and what the Academy is doing to advance the specialty. The specialty was started in the early 1900s with the vision of Dr. John Coulter and Dr. Frank Krusen. After founding the first academic department at Temple in 1929, Dr. Krusen moved to the Mayo Clinic to start a department of physical medicine in 1935 and a physical medicine residency program in 1936. Physical medicine at that time primarily referred to the use of physical agents such as heat and electricity to treat disease. The specialty of physical medicine was formally recognized in 1946. Then comes along the concept of medical rehabilitation, which became prominent after World War II with the vision of Dr. Howard Rusk. He established rehabilitation programs for injured soldiers that expanded to the civilian population. He also advocated for the development of medical rehabilitation as a separate specialty. But he did recognize the similarities with the already established specialty of physical medicine. 1948, Drs. Rusk and Cruzen recommended that the two fields come together, and the specialty of physical medicine and rehabilitation was born. Understanding how our specialty formed from the alignment of the fields of physical medicine and rehabilitation medicine has given me a deeper respect for the scope and diversity of the specialty. This diversity, as you know, is a strength, but this history explains some of the challenges we are still having today with identifying who we are and our role in the healthcare system. Our specialty continues to grow. In 1978, the Academy only had 1,000 members. 1992, 4,000 members, and now we have over 9,000 members. We are still a relatively young specialty, but we are growing and expanding our reach. Let me tell you some of the things the Academy is doing to support and grow the specialty. Several years ago, the Academy launched our PM&R Bold project to develop a vision and strategy for the specialty. We solicited input from thousands of members and developed this vision for the future. The vision is that physiatrists are the essential medical experts in value-based evaluation, diagnosis, and management of neuromusculoskeletal and disabling conditions. We are indispensable leaders in directing rehabilitation and recovery, and in preventing injury and disease. Physiatrists are vital in optimizing outcomes and function early and throughout the continuum of patient care. From this vision, we launched initiatives to define the future of physiatry in 4 practice areas, recognizing that we are a diverse specialty and we had to start somewhere. The practice areas are musculoskeletal care, rehabilitation care continuum, cancer rehabilitation medicine, and pediatric rehabilitation medicine. We are currently looking at pain management as the next practice area of focus. This week, I encourage you to attend the Bold informational session this afternoon to get in-depth details about our work to advance PM&R Bold. We also have 4 learning collaboratives, 1 for each practice area, for members to gather together and chart the course of our future. We are Team Physiatry, if I could get the finger back up. And we should celebrate that. We should celebrate Team Physiatry, and I love this graphic that the Academy staff put together. We are working together to advance the specialty. It's important that we are inclusive and cohesive as a specialty. There are many challenging and controversial issues ahead as healthcare evolves, including workforce constraints, establishing our identity, GME training needs, expanding our reach into different care settings, and proving our value. We may not always agree 100% on the tactics or initiatives to advance the specialty, but I am confident that we can agree on the strategy that we are an essential, indispensable, and vital part of the healthcare system, adding value across the diversity of our patients and practice settings. We are stronger together. We need to embrace our specialty of PM&R, be proud of what we do, and let everyone know what we do. The Academy is leading the specialty in that journey with an ambitious and multifaceted plan. This year, we have formed an Inclusion and Engagement Committee led by Dr. DJ Kennedy. We recognize that we are a diverse specialty, and the I&E Committee will work to develop and foster the Academy's goals around the inclusion and engagement of our members. For example, just yesterday, we launched our inaugural PM&R Critical Dialogues Assembly of Delegates meeting. Delegates from our member communities gathered to have several critical conversations to help inform the Board of Governors in their strategic decision-making process. Through PM&R Bold, we learned that the lack of understanding of PM&R and its value within the healthcare system is a key barrier to our specialty's advancement toward the new vision. To address this concern, we formed another new committee, the Specialty Brand Expansion Committee, led by Dr. Andre Panagos. This committee will focus on advancing the awareness, appreciation, and value of the specialty with key stakeholders outside of PM&R. You also have a new opportunity to engage and connect with your peers in our member communities. These are self-identified, organically established communities that are clinically focused, practice-focused or identity-focused. They are a wonderful way for members to connect with each other. There are now 38 member communities. If you have not joined a community, sign up and make a connection with your peers. If you have an interest or identity not covered by a current community, form a new one. These communities gathered this morning for the inaugural Community Day for Education, Discussion, and Planning. Your voice is important as part of a member community and as an Academy member. Well, what determines our future as a specialty? It is the value we bring to the healthcare system by providing outstanding patient care, leading to functional improvements, and enhanced quality of life, and doing that in an efficient, cost-effective way. The Academy is working to prove our value. It is in PM&R Bold, our advocacy, education, leadership training, and supporting our members so that we have a voice where decisions are made. Last January, Dr. Matthew Grierson was elected to serve as a member of the AMA Relative Value Scale Update Committee, or RUC. The RUC is an expert panel of physicians that make recommendations to CMS on the resources required to provide a medical service leading to appropriate reimbursement. Having a physiatrist as a member of the RUC for the very first time is evidence of our increasing recognition and value. Your Academy leaders and staff spent time this year working on the definition of a rehabilitation physician in the inpatient rehab setting, including making several visits to Washington, D.C. For decades, CMS has broadly defined a rehabilitation physician in an inpatient rehabilitation facility as a physician with specialized training and experience in inpatient rehabilitation. But CMS never specified what qualifies as specialized training and experience. Throughout my career, I considered a rehabilitation physician to only be a physiatrist. That is the model in which I trained and the model in which I work. Earlier this year, CMS proposed and finalized a change to the regulation to give IRFs, or the inpatient rehabilitation facilities, the sole discretion to determine who is a rehabilitation physician. I was surprised to learn that in a national rehabilitation hospital system, 30% of the physicians are not physiatrists, and adequate training for a rehabilitation physician could be as little as 20 hours of CME. The Academy brought numerous members and stakeholders together in opposition of this change. Personally, I have found a rewarding and exciting career working in inpatient rehabilitation. Some may say that it is hard to recruit physiatrists to work in the inpatient setting. If these positions are not appealing for whatever reason, I challenge us and the rehab industry to partner together to make these positions attractive career choices. Physiatrists in these settings need to be valued for their medical expertise and leadership, and they need support to manage the increasingly complex medical issues in patients admitted to inpatient rehabilitation. The Academy will continue to advocate for inpatient rehabilitation patients receiving care by the specialists best trained to manage their needs, that is, physiatrists. To continue work on this issue, the Academy has formed a work group to focus on the future of inpatient rehabilitation and its impact on patients, history, industry, and physiatry. In the coming months, look for more information coming from this work group. To really prove our value, we need data to document our patient outcomes. We need to show that we are better at managing musculoskeletal disorders than anyone else, and that rehab patients have better outcomes when treated by a physiatrist. There are many examples where patient care and outcomes are better when we are involved. But can we document it in a way that serves the future needs of you and the specialty? The Academy is committed to developing a registry to help answer those questions. The registry will provide the data that is essential for the specialty to prove our value. It will also improve your care by tracking your success with patient outcomes and provide national benchmarks. I encourage you to learn more about our registry and support its growth. Well, what is our future? Our founders showed passion, dedication, and resolve to establish the specialty because they saw enormous potential to help patients improve their function and outcomes. We must have the same passion and resolve to chart the future course of our diverse specialty. I have found a home in the specialty of PM&R and in the American Academy of PM&R. The Academy is working to advance the specialty for your patients, your practice, and your future. We need to make sure that every rehab patient has a physiatrist. Every community recognizes the need for physiatrists, and every healthcare system realizes that they can't provide high-quality care without physiatrists. It is time for us to be bold and chart our future in the ever-changing healthcare system. Closing, I want to thank all of you for being members of the Academy and supporting our work. Special thanks goes out to the hundreds of members who volunteer their time and expertise to support the work of the Academy. I can't say enough about the amazing staff of the Academy. They are a smart, talented, and innovative group that is tireless in their work to advance the specialty. I recommend that you should become an Academy volunteer just for the opportunity to meet and work with them. Let's give the Academy staff a round of applause. Sorry, I didn't mean to have my family up there yet, but you get a preview of my family. Anyway, personally, I also want to acknowledge the patients I care for at our Level 1 Trauma Center. Every day, they challenge me to be better at connecting with them and be a better doctor. I admire their resiliency to overcome adversity and achieve great outcomes. Thanks to my colleagues at the University of Washington, who are an accomplished and compassionate group of clinicians, teachers, and researchers. And to the capable residents who are the future of our field. Thanks to the current and past members of the Board of Governors, who I have spent endless hours in conference room discussing the future of our specialty over the last several years. They are dedicated and visionary physiatrists, and I am proud to call them my friends. I especially now want to thank my family for their endless support. They are here today. My wife Cynthia and I met over 45 years ago. When we met, I was this science-focused undergraduate, and Cindy, as a talented architect and artist, somehow taught me to appreciate the arts, helping me appreciate what really matters in life and be a better doctor. Our children are here, and they are all helping the future of our world in their own way. Our son, Andrew, is helping to save the planet by working for a company that builds wind farms. His wife, Kristen, is, like us, helping one person at a time by serving as a physical therapist in the VA system. Our daughter, Elizabeth, is a third-year medical student, still undecided on her career choice, but it's nice to have her here to see what this specialty is all about. And my soon-to-be son-in-law, Whitney, is working to figure out how driverless cars will really operate. Imagine the day when our patients will no longer have to ask us if they can return to driving. If they can get into a vehicle, they can get to where they need to go. It will be an enormous breakthrough for people with disabilities. Thank you for the opportunity to serve as the president of the American Academy of PM&R. It has been my privilege and an honor.